Hello, I am Xavier Collard. I'm an orthopedic surgeon and chief department in Ambroise Paré in Mons, Belgium. The purpose today is to present you the case of a male of 70 years old. And this patient had in the past a previous surgery for a spinal stenosis 5 years ago. The trouble with the patient is now a relapse of a new discal hernia and a spinal stenosis. We perfectly know that in this situation, the trouble for the surgeon will be the battle to dissect the fibrosis around the dura and the nerve rods. But hopefully we have now on the market a new system named CADIS, and this product will help us to achieve more selective dissection of the soft tissue and the fibrosis to preserve lesions of the dura and the nerve rods. It's clear on the MRI that the trouble of the patient is a spinal stenosis between L3 and L4, and between L4 and L5 we are here as an articular cyst and a relapse of a discal hernia. On transverse view, on the MRI, here is the articular cyst, the relapse of the discal herniation is here, and here is the surgical scar, fibrosis close to the dura. So now, during the surgery, the laminectomy between L3 and L4 is already done, but now we can see that we have a lot of fibrosis close to the dura. That's the moment to introduce the CADIS in the surgical field. So after 5 minutes is the moment to remove all the products from the surgical field. And now we can see that it will be more easy to remove all this fibrosis with the CADIS dissector. You can see here the CADIS dissector, and I can remove easily the fibrosis close to the dura without any lesion of the soft tissue. Depending on the experience of the surgeon, you can use dissector or rongeur to remove the fibrosis. And you can see that there is no risk to make a lesion of the dura. And now at the end of the procedure, we can perfectly define the different planes. The dura, the bone, and the spinal canal is completely free, and that was the goal of this surgery. The last step of the procedure is to wash the surgical field to remove all the product. In conclusion, the different steps are very important for the use of CADIS. So you have to start your surgery by a usual approach until you reach the fibrosis close to the spine. After that, you have to respect the different steps. First, you have to instillate the product on the fibrosis. And it's very important to wait 3 to 5 minutes before starting removing the fibrosis. So you instillate the product, you wait 3 to 5 minutes, you remove the products, you start your dissection with your CADIS instruments. And after that, if you want to restart a new time with the product, you follow the same steps. And at the end of the procedure, you have to rinse with cold water to remove all the product from the surgical field.